Fiber and athletes. Have you ever noticed that there are guidelines and focus always on stuff like protein and carbohydrates when it comes to sports nutrition, but we never ever talk about fiber? And as IBD dietitians and people that like to talk about the gut and IBD and the intersection of that and, sports nutrition, we thought we'd talk about fiber and the important role of it and why it's really called the forgotten carbohydrate. So let's dive in. So I'm Ashley.
I'm Christa.
And we're the Crohn's and Colitis dietitians. And Christa is our IBD focused sports dietitian. So who better to have on here to talk about it than you? So let's talk about fiber.
Yeah, I agree. This is often a missed one. And so I think when we think about dietary fiber, most people are thinking fruits and veggies. And yes, that is included into that umbrella. And there are different types of fibers, soluble and insoluble, and different viscosities and things and ways that we can use fiber, but also things like oats or chia seeds, lots of different options there. And often in our athletes, I feel like we can either go too far one way or the other. We can either have a lot of fiber in our diets and maybe see some symptoms, related to that, or we cannot have enough because we're trying to manipulate fiber and so that we don't have any symptoms around our runs or our competitions or trainings and things like that. So we kind of want to clear some things up today.
Yeah, and I feel like with IBD athletes specifically, I think we rarely see people overdoing fiber.
Yeah.
Because if you're an IBD athlete, you're probably more so skimping on it. But you brought up this article that was published not that long ago on it's titled Fiber and the Forgotten Carbohydrate. So what role does fiber play as a carbohydrate?
Yes, fiber is so important. So it helps preserve our athlete gut microbiome, preserve the diversity and the stability, making sure that the intestinal barrier stays nice and healthy and it stays functional. And then obviously we're producing things like short chain fatty acids that help to maintain a healthy environment in the gut, and they provide us, the host, with beneficial outcomes. And so we want to maintain all of that, and we want to make sure that that's a priority in our nutrition strategy as athletes.
Yeah, and so you mentioned short chain fatty acids, which we've definitely talked about a lot on here. But short chain fatty acids, from a gut perspective, we're focused on their role in helping to repair the gut from damage that goes on. So important in IBD, where you have this auto damage happening, and especially in flare-ups. And then also they are the fuel to your gut cells. They help with inflammation reduction within the gut, but also systemically. So that definitely would play a role in stuff like recovery, right?
Yep.
For athletes, like your ability to recover. Yeah. So what happens in the gut if you're not consuming enough fiber?
Yeah, if we're not having enough, then over time, we're going to see negative effects. And sometimes when I've noticed with, if we manipulate fiber and we don't have enough, maybe we're eating a little bit more, like lots more protein, maybe more animal proteins, which is really common in our athletes, then we might see a slight reduction in symptoms in the acute phase, like right after starting that. But over time, that's not going to be helpful or beneficial for long-term health and for a nice pattern that would reduce overall disease severity or symptoms over time, right? Because we're not nourishing the gut lining. We're not providing those cells with the fuel that they need to repair and rebuild. And so we'll see degradation of that intestinal barrier over time, which we will see more symptoms in the long run, right? We'll see, either usually more diarrhea, there may be more bleeding. And especially if you're thinking about a disease process within high intensity exercise, long running, things like that, we're going to have more heat and there's more stress. And so if we don't have these helpful these helpful preservation of the gut microbiome through fiber, then we're going to see more of a negative impact to the gut over time.
And it's interesting. I've never really thought about fiber being I haven't thought about it that much, fiber being a carbohydrate.
Yeah, I know. It's something you kind of forget about.
Yeah, I thought it's interesting that that was the title choice, that because nowadays you hear people say stuff a lot on popular podcasts like you don't need fiber at all. Like we don't use it. That's how it's talked about online. But to also consider the fact that these other roles of fiber, that not only does it help with short chain fatty acid production, but that's also plays carbohydrate roles.
Yeah, absolutely. And it is helping to, when we're thinking about total carbohydrates for an athlete, we're thinking about obviously that's going toward our energy needs and, carbohydrates needs related to the activity. And those are going to be usually high, and I think you can think carbs in that realm. You tend to think rice, pasta, bread, maybe potatoes, but that's kind of usually your typical idea as far as like carbohydrates that are going to be directly related to improving athlete function and performance. But we can't forget about the colorful pigmented fruits and veggies and other whole grains and things that would be considered in that fiber category.
Yeah, and before we started filming, we were talking about fiber needs and how they really do change based on demand and your caloric intake. So let's talk about how much does someone need? Let's say they're on standard diet versus, maybe a professional athlete that's bumped up their calories to 4 to 5,000. Like, talk about that for a second.
Yeah, and so we kind of hear the usual recommended intake is somewhere between 25 and 30-ish, 35 grams a day of fiber. And not that is bad or anything, but that's usually in relation to a 2,000 calorie diet, And so usually whenever we're trying to look at the total diet and if we've got to increase intake based on needs and we're pushing 4 or 5,000 calories, however much we need, usually the goal is around 14 grams per 1,000 calories of fiber. If you're pushing 4,000 calories, that's upwards of 55 grams of fiber. So you can see that's quite a bit more than what's typically recommended, but it's because it's in relation to the total calories that we need. And again, because we want to maintain that microbiome diversity and stability, that fiber should increase usually with how many calories we need. And yeah, so that's usually about the goal.
It makes sense because as your activity goes up, we know calories in demand increases a lot.
Yeah.
And we automatically go to, well, protein should go up too, because the longer protein and then fluid and then carbohydrates. And those are all things we automatically think about. But there is, other than what you just mentioned, fiber is really never talked about in that way. We're not talking about scaling your fiber. And of course, in the IBD athletes specifically, that can be challenging on its own to scale up fiber. And it's not something that we want to go 0 to 180 with. Like, it is something that we would want to progress with, especially in IBD, because of how often people struggle with it, and then just how common strictures are in the IBD population. So, I mean, I think the same tips apply that would for just a regular IBD patient, of like how you introduce it, the speed at which you introduce it, and then things like blending and stuff like that would be
And hydration.
helpful. And hydration. And then I could imagine, like in an IBD athlete, that can certainly get complicated with scaling all of these things when the hydration piece isn't quite in place, because
absolutely
the hydration piece plays a role in your ability to scale the other things, but then also can play a role even in our gut.
Yeah, I talk about that a lot with my athletes. Is your carbohydrate and hydration intake play such a crucial role in protecting your gut lining while you're in activity, and especially if we're in high intensity or if we're in long duration activity, that has to be we have to address that, and that's something that's so important.
Yeah, we don't often think about it, but your gut, the mucosa that lines your gut, is actually, it's made of water, and so we need to keep that intact, because that mucosa is so important for protecting the integrity of the gut environment.
And that water can also act as like a shock absorber. When you're thinking about like like running, you're constantly jostling, or if you're in kind of some sort of contact sport, that helps to absorb some of those extra jostling of the gut.
Yeah, that's so interesting. As you scale all of these things, be also thinking about fiber and also water, because you don't want to scale fiber without making sure you're getting enough fluids. So what do you think, what are some of the consequences of, not having enough fiber from the athletic standpoint? I mean, I think from the gut standpoint, we get the importance of it in terms of inflammation reduction and keeping your gut microbes happy. But what are some things you see on a larger scale for the athletes you work with that are not getting enough?
Yeah. I feel like a lot of times it can correlate with total carbohydrate intake. We're not meeting needs in that category of macronutrient. And let's see what else. It can certainly contribute to just altered bowel habits, like contribute to constipation over time. Sometimes more reflux, sometimes even leading to more like hemorrhoids and things like that.
Mm.
And yeah, and I think too, just over time, it's hard to directly link the two, but um, that degradation of the lining of the gut, we can see more bleeding and things happening, because there's just that gut lining has deteriorated over time, with lots of impact, or whatever sport that we're in. We can see the effects of that, and it's usually in part due to just a lack of fiber over time. So lots of negative impacts, really.
Yeah. Okay. So key takeaways here: don't forget fiber.
Forget
if
fiber.
you're if you're an IBD athlete, don't forget fiber, and keeping in mind the importance of scaling and in how fueling becomes very, very important, not just for your performance, but also for your gut. Because if we're not getting enough overall, that can impact your gut, and we don't want to get into malnourished spot. And if you're somebody that needs a little bit more one-on-one guidance on this very topic and intersection, Christa is taking patients at the Crohn's and Colitis dietitians, and she'd love to take you on and work with you. Now's a great time to get started, because this is her open season where she has more open time before the fall hits and she starts teaching again at her university. So definitely reach out if you'd like some support, and thanks for hanging out with us today.